Hello, I'm Dr. Reels from ICT Muscle and Joint Clinic, and this is Dr. Sparks.
Hi.
Today we're going to be giving you some take-home running exercises to basically supplement kind of your strength training program. For full details on that and how to improve your running economy, check out our blog. But from here, basically, we wanted to organize moves that had little equipment but were really effective. So the first exercise we're going to show is basically to kind of wake up our feet. Throughout the day in shoes and whatnot, they become desensitized. So obviously in running, having that input to the feet is going to be crucial. So I'm going to give Dr. Keith some input here on and some tips on proper foot placement and getting the foot intrinsic muscles activated. So first things first, I'm going to talk about the tripod. Basically, we want the back heel and the fifth metatarsal and your big toe, so basically your pinky toe, big toe, and heel, to basically, I'm also going to spread his toes out a little bit. Good, so those should be the point of support. So from now, the first one I'm going to ask him to do is keep his big toe down and then lift up his little toes. Perfect. While, again, engaging that tripod. Yep, and just, we never really give reps, we just go to tolerance. So whatever Dr. Keith's capacity is, he'll kind of know what it's at. Good, so now let's switch. We're gonna actually keep these ones down and bring the big toe up. It's pretty difficult. There you go, perfect. So you can tell he's kind of compensating a little bit, but over time, him doing this exercise quite a bit, he should be able to have those like working independently of each other. Perfect. So the next one we're gonna do is a banded hip march. So I'm basically gonna wrap this around Keith's midfoot right here, good. And we're gonna stack something about 6 inches to a foot. Next up, we're gonna ask him to basically get some belly press in here, pressurize, good. And then I'm gonna ask him to do a glute bridge. So we're gonna hike up the hips, perfect. And he can have his hands down by the side if he wants a little more support. And then he's just gonna start marching. And so if you constantly feel like your hip flexors are always tight, they actually might be more a weakness. So these are kind of my go-to exercise starting off. And again, it's a good take home too. Perfect.
One of my favorite exercises for runners is just a wall running man. It's a little bit different than your typical one where you're just lunging back. It gives more forces pushing outward, which helps prevent internal rotation of the thigh, which we see in crossover gait patterns a lot. So we're gonna have Sam stand next to the wall. And I want your foot a little bit closer here. So now when you bring this knee up a little bit, bend the ankle, we want to almost have like a window pane right here. And then what I'm gonna have him do is sit back in your hips a little bit. Perfect. Now to keep yourself upright, I want him to push his weight there, which then he has to work on stabilizing this hip better so that way he doesn't fall over this way. But now from the side, if you can see it, he's in a running position. We want to be able to have a good low back position, nothing too anterior tilted, too posterior tilted. And then if we really want to get fancy on this, we're going to do a little bit of a toe wiggle drill that Sam had me do on the first exercise. So from here, pick up just your big toe. Good, and back down. Pick up your outside 4 toes. Great, and back down. And he did a great job holding his arch. He's activating both of his glutes to stay nice and strong to prevent his knee caving inward.
So the last exercise we're gonna do is basically a modified lunge on the TRX. Anyone that knows me knows I love the TRX. So this is great because we're kind of combining all the exercise that we've already shown, and now we're basically doing a unilateral. If you have a strength deficit between each side, maybe some balance issues, we're gonna address all those. So all I'm gonna ask Dr. Keith to do, we hooked him up, threw his foot in the little horseshoe here, and he's gonna go basically drop down into a running stance. I want him to drive up. Again, getting some hip flexion. We could have his shoes off, working on those toe and intrinsic drills as we were talking about earlier. And again, you can see this will basically translate perfectly into running.
It's a good one.
Yeah. Awesome.